Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. My email is sreeklpm@gmail.com. Today we are going to talk about a very interesting topic, localization of 4th and 6th cranial nerves. Cranial nerves part 36, oculomotor nerves part 22. The localization of the 4th and 6th cranial nerve palsies. First, let's talk about the 4th nerve, the trochlear nerve. The 4th cranial nerve is slender and has a long intracranial course. These two factors increase its vulnerability to injury. So, the most common etiology of acquired 4th nerve palsy is head trauma, because 4th nerve is slender and has got a long intracranial course. The action of superior oblique are intorsion and depression, and therefore in the 4th nerve palsy, the patient is unable to depress the adducted eye on attempting down gaze. Therefore, patients may have problem when looking down as when reading a book or descending stairs. Patients may tilt the head to the opposite side to eliminate the diplopia so that the affected eye may go into extorsion out of the field of action of the weak superior oblique. If diplopia improves with the head tilt to the left and worsens with the tilt to the right, the patient has got a right 4th nerve palsy. A nuclear lesion causes the 4th nerve palsy on the contralateral side, that is the superior oblique. This is a very important point to differentiate between the 4th nerve nuclear and from a peripheral nerve lesion. A 4th nerve nuclear lesion causes superior oblique to get affected on the contralateral side, because the superior oblique is supplied by the 4th nerve on the opposite side, nucleus. So, nuclear lesion causes 4th nerve palsy, that is superior oblique palsy, on the contralateral side, whereas if it comes peripherally, the superior oblique on the same side gets affected. A very important point. So, now let's talk about the 6th nerve. 6th nerve supplies lateral rectus, and therefore when the 6th nerve gets affected, lateral rectus gets affected. So, they will complain of double vision on looking at far off objects. Whereas medial rectus is supplied by the 3rd nerve, and therefore if there is a 3rd nerve palsy, they complain of double vision on looking at near objects. So 6th nerve palsy, patient presents with horizontal double vision on looking at a far off object. The 6th nerve nucleus contains both lateral rectus motor neurons and interneurons that project up to the MLF, so that a lesion involving the nucleus causes an ipsilateral gaze palsy rather than a 6th nerve palsy. So a nuclear lesion causes lateral rectus and medial rectus on the opposite side palsy, so it causes a gaze palsy. Whereas the 6th nerve palsy affects only the lateral rectus and causes lateral rectus palsy. Again, a very important point to differentiate a 6th nerve nuclear from the 6th nerve fascicular or peripheral lesion. False localizing side. Elevated intracranial pressure often produces 6th nerve dysfunction because of stretching of the nerve over the petrous tip, as the increased pressure forces the brainstem attachments inferiorly. Therefore, the 6th nerve palsy may not bear any necessary anatomical relationship to the CNS pathology producing them. So, this is known as false localizing sign. So, a raised intracranial pressure may cause 6th nerve palsy, and this is called as a false localizing sign, because the nerve over the petrous tip has the increased pressure force the brainstem attachments inferiorly. Greden-Egos syndrome. If there is a 6th nerve palsy along with facial pain and first division of the 5th sensory loss because of the lesion of the petrous apex, we call that as a Greden-Egos syndrome. Bilateral 6th nerve palsies may occur because of the tumors along the clivus, where the two nerves lie close together. So these are the important concepts of localization of the 4th and 6th nerve palsies. The other important concepts of neurology, most of them I have put it in a question and answer format. especially useful for students, in a book called Focused Neurology written by me, S. Sreenivas. It is available online from all leading booksellers including Amazon. If interested, it could be bought online. I hope you have enjoyed listening to my video, the third nerve, the fourth and sixth nerve localization. If you have enjoyed this, please share the link with your friends, but do like this video and subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.